Good morning, everyone. We're just going to go ahead and give it a little bit longer just as people are signing on, and we'll go ahead and get started. Thank you for joining us this morning or afternoon if you're on the East Coast. All right, Andy and Renee, when do we want to get started?
I think let's go for it.
Yeah, I'm ready to go.
Yeah, and people can just hop in. All right, so thanks everyone for joining us. We were just talking about how we weren't sure how many people were going to show up. So this is really great to see such a nice turnout. So this is our inaugural webinar on applied research and careers in the health industry. It's really great to see so much interest. For those of you who don't know me, I'm Renee Magnan. I'm the president of Social Personality and Health Network, the organization that is sponsoring this. And today we have Drs. Andy Hurdle and Dr. Brandon Tran, we're gonna talk about their experience, in some cases moving into more health industry and their experiences in that area, which is a lot different than for many of us. So I'm just going to do a real quick introduction to our speakers, and then I'll hand it over to them. Dr. Andy Hurdle received his PhD in social psychology from the University of Minnesota, and he was an associate professor of psychology at Knox College. He currently works in the Research Development Office within the Academic Affairs Department at Samaritan Health Services in Corvallis, Oregon. He supports grant writing, manuscript writing, and collaborations with external partners for investigator-initiated projects, as well as also maintaining his own program of research, including projects related to sepsis, homelessness, pain management, addiction management, and stigma, and prevention of substance misuse. Dr. Brandon Tran received his PhD in social psychology from the University of California, Riverside. He currently works in the Riverside County's Office of Service Integration, where he develops, highlights, and evaluates the effectiveness of integrated service models for improving the county's resident access to publicly available health and human services. Brandon serves as the system administrator over an integrated case management system and leverages medical and service utilization data to identify gaps and opportunities to improve county operating procedures and care delivery. Before I say please join me and welcome, I also want to just make sure that everybody knows that we are recording this session. If you have questions or if we get to the discussion piece, just be mindful of that. So with all of that, I want to give a real big thanks to Brandon and Andy for doing this, and I'll hand it over.
Thank you all so much, and thank you SPHN and Renee for having us. Thank you, Andy, for co-hosting with us. And so welcome, everyone. This is the Applied Research and Careers in Health Industry, our inaugural webinar. So thank you all so much for joining us. And so with that, we wanted to start off with talking about what are the types of health research opportunities in industry, so to speak. And so often a lot of us in this group think of ourselves as academics, or at least we started out in academics. My challenge would be, can we reframe what people think about as academia? When we think about outside academia, what we're really thinking about is places that you can do academic work. And so it depends, depending on the industry, the setting of the workflow, but functionally speaking, it's very similar in terms of processes. An example of this is research exists everywhere. And so when we think about understanding what do you think about when you say I am an academic or I am in academia versus industry, it's really kind of talking about the same skill set and really just branching out how you apply and utilize said skills. Something to think about is oftentimes IRB writing is super useful, for example. I found it to pay off in spades for me in terms of working in industry, because there's oftentimes research studies that work on the health sector. For example, every academic hospital system has an IRB as well. And so there's a lot of opportunities to stretch what we think about as academic work and across different spaces and opportunities that we can apply them. Additionally, another way to think about it is really reflecting upon what are your skills. In academia, we tend to really focus on what is my subject matter expertise? What am I studying? What is my area of focus? What I personally found in my journey is that it's less about the subject matter and more about what skills you have that can be applied more broadly. I find the subject matter expertise to be very helpful for contextualizing and understanding, but it's really about understanding what skills do you have and how can they apply to other contexts and settings. So distilling your idea of, I am a graduate student, I am a professor at a R1 or R2 institution, I am a specific person, and tying my identity to my research topic. It's more so understanding what skills that you have and how can be applied more broadly in order to action some kind of change or implement something new. Other things to think about is that from our realm of work, speaking from a healthcare system, health service organizations all have quality assurance teams. And so there's always research to be done about what is the quality of the service we're delivering, and whether this is in something more directly applied like a medical setting or a hospital system, or maybe you're working for a health industry or a company like a pharmaceutical company that, again, provides research evaluation to understand the quality and assurance of the products that they're selling or trying to sell or get through. Additionally, another thing that was really interesting for me, at least, and I'm going to turn this over to Andy to reflect on his experiences as well, is just research in academic versus non-academic settings. For me personally, I found that they have totally different styles and functions to them. For me in academia, it's always been come up with your hypotheses, do a lit review, do all the basic steps, and really make sure things are hammered home. And then you test your hypothesis based on this huge backlog of informed decision-making and thought process based on the literature. What I found personally in industry is it's less oriented on what is all the literature saying. It's more, how do you fix this problem that's facing us today? How would you get this done in 2 weeks, 3 weeks from now, versus a full 1 year long study proposal kind of deal? And so I found myself engaging in a lot more of this PDSA or Plan, Do, Study, Act. You may have heard this as PDCA, as Plan, Do, Check Act. But functionally, I found myself engaging in more of this quick turnaround iterative process compared to when I was in academia, where research was much more methodical and planned out. And oftentimes the aims change as we go. So we might say, how do you fix this problem that's facing us today? For example, why is it that some of our patients aren't coming to services even though we're offering it to them? And we might learn something new. And then there's another PDSA cycle where we say, okay, well, why is that happening? Why is that happening? And so it becomes a lot more progressive research that changes as you go, versus in academia where you come up with this big long theory and understand how is it going to align and where is it going to go. I actually want to turn it over now to Andy to ask, Andy, what is your thoughts on how you reframe academia in your experience?
Yeah, I think part of where Brandon's coming from, and part of sort of our bolded bullet point here, reframing academia, is our ongoing conversations about what does it mean, like what does our work mean, and what does it mean to be outside of a traditional academic setting. And I think to a certain degree, questioning how people think about what academic work is. And so I think what I've come to learn quickly over time is, and Brandon touched on this pretty directly too, that I'm doing academic work still. I'm not in an academic setting. And so I still approach things as if I'm coming from that particular setting and have that particular mindset and skill set, but also adjusting to the more on the ground, real world setting that I'm in a different industry. Because to be clear, I am in a different industry compared to what I was in before. The academic industry does have a particular direction to it. The healthcare industry is a different direction. And so I can do academic work in this different industry, but molding how I approach it to what the industry really wants and what the goals of the industry are. So sort of jumping off that, one of our ongoing discussions is just about how we go about working with people in our particular settings. And I think, along with that notion of jumping industries, but still doing academic work, you can still engage in academic work, but you have to be able to communicate it to people who are not necessarily used to that type of work, and maybe not even used to necessarily scientific work, and with people from multiple backgrounds. So I'll elaborate more probably on this later too, but I'm in a small office of 3 people with a variety of backgrounds, a social epidemiologist, an epidemiologist slash biostatistician with a medical background, and then me with a social psychology background, who are a core unit or constantly in communication with each other, but have to really listen to each other and understand each other to know even what we're talking about for basic things like study design questions. What is an example I've come back to with Brandon quite a bit is a study that I might call a prospective observational study is a study that my epidemiologist colleagues might call a retrospective cohort study. Very different types of labels used for ultimately what is the same type of design, but it takes a little bit of really feeling each other out and really getting used to what each other's talking about in order to understand how to collaborate together. So there's those are conversations that are worth like having, and all the while making sure that you're still bringing in like what what you're confident in the training that you've received, which is really excellent training just from one particular type of discipline. That extends, those conversations extend to people who are more outside of your particular skill set. So we have there's one project that we've done recently that's a project that's really of interest to our C-suite, and data that has come out of this project is getting communicated to the C-suite through intermediaries, and then it's a process of trying to really depict what we know from our scientific side to an audience who's able to process that pretty quickly, but maybe not at the specific nuance level that we're interested in. And then navigating conversations like, what is statistical significance? What does it mean if you have statistical significance versus not for particular types of questions that are being asked and answered? So it's a different setting with different people where you're really trying to leverage your skill set and your knowledge base that you have and trying to communicate that effectively with others while coming to a shared understanding, which to me, is really, that's a really exciting part of the job to me. The ability to collaborate with people who are outside of my discipline background, through which I think we can actually develop a stronger scientific approach.
I can echo that, Andy. Navigating collaborations with non-researchers was also one of the first challenges that I actually had when I started this kind of role, because what I've learned is that for us in the academic realm, it's always about the nuance. Like, what are the potential confounds? What are the nuances? What are the little details that we should pay attention to that, this is the same. This is like the abstract take home with the caveat of read the discussion section and limitations. However, when I found working with individuals, especially the higher elevation you go up to the executive, the C-suite levels, the chief officers, they don't care as much about nuance, and it's much more about how do I convey the significance of my message or what the data is telling me in a way that they understand in like one sentence. That has been very challenging, but it's also been a very interesting stretch goal that I personally made of myself to try to say, how do you share this information in a way that's digestible and understandable to give them what they want while also creating space to, offer nuance. And so that was an interesting thing, because when we were in the academic realm, everyone kind of understands and speaks the same language. It was so interesting to jump out of that and go in a realm where suddenly you are speaking in a language that no one else seems to understand. And so that was kind of fun and interesting. And getting to the next point is other opportunities in industry is really speaking more to my current role. Is I started out as more of a researcher, and from there, though, I expanded into understanding business process design and evaluation. And this echoes more of that idea of problem solving. When we think about how do we do methods in academic research versus industry research, of course, it varies depending on your organization. For example, Andy is more in the research wing of his medical system organization. I previously was in the research wing, but I've moved to more of the business process wings. But the idea is that oftentimes we're often doing new things like, okay, this is the problem. We're trying to get these customers or these patients to come into our clinic and get service. Here's a gap. How would you solve it? And so it becomes a lot more ad hoc problem solving compared to what we did before in academic research, where you do an extensive literature review, get an understanding of all the stuff that's happened in this field to make sure that your things informed. Often I found that it's much more, here's the problem today, you have an hour, figure out what you can solve and give me a solution. And we kind of run with it and kind of do this plan, do, study, act. And of course, all that subject matter expertise we have is great for informing where to start, but it's also a different approach than what a lot of people may be used to in the academic realm. Anything else, Andy, on this slide before we move on?
No, I think we can move on.
Sounds good. Thank you. Feel free, Andy.
Yeah, so part of what we wanted to communicate is our backgrounds into our particular positions now, to give you sort of insight into what your trajectory into this type of career could be if you want to pursue this type of career. So if, for me, my general orientation is to try to develop evidence-based applications for improving health and well-being. It's a very broad statement, but that's my general orientation. My focus has been on substance use, particularly substance misuse. It's also turning to stigma and also turning to social determinants of health. Those latter two interests really manifesting more since I've been in my position now. So for a little bit of background on that, just to flesh that out a little bit more. So with substance misuse, for the entirety of my career starting in grad school, I've been involved in substance use research in some way, shape, or form, either smoking cessation or adolescent tobacco uptake, or cannabis use or alcohol consumption, particularly amongst college students. And one of the things I've been doing in that space is trying to develop new intervention techniques to prevent substance misuse. So really trying to get at the evidence-based applications for improving health and well-being. In my current position, I am getting more involved with stigma research. I think in the healthcare industry, this is a big topic: stigma, weight stigma, race, ethnicity stigma, substance use stigma, etc. My interaction so far, for the most part, has been with substance use stigma. So we've got a new project that's going to be happening here within our system, and we have some questions about that project that have to do with stigma. So it's an interesting foray into that, but that's all guided towards, is this particular project that we're implementing having some sort of impact on stigma, and what can we learn from that in order to actually improve the healthcare and the healthcare outcomes for our particular patients. And then social determinants of health, also a very important topic in healthcare. And there, I'm learning, I have the opportunity to really try to connect social determinants of health to healthcare and healthcare outcomes, but I'm trying to understand the psychological processes that translate those social determinants of health into those particular endpoints, while then trying to leverage that information, hopefully, to be able to kind of nip the disparities in the bud via psychological mechanisms that translate social determinants of health into those endpoints. So that's where I'm coming from in terms of mission, values, and goals and visions. My educational journey was fairly linear, although I had some plateaus here and there. So I finished my PhD, what seems to be quite a long time ago now, in 2009, at the University of Minnesota in the social psychology area there, but with a primary focus on health behavior. I then, after doing some other life things, ended up at a postdoc at the University of Illinois at Chicago Institute for Health Research and Policy. There's where I did some work on adolescent tobacco uptake, and had a wonderful experience there. I had a wonderful experience at University of Minnesota too. After my time at UIC, it was time to actually get into a position somewhere, and I had the fortunate opportunity to get into a position at a small liberal arts college, Knox College, which is in Western Illinois. So I was situated there for 10 years in our psychology department. I also helped to construct, and then was chair of our health studies minor, which was an interdisciplinary minor, really kind of capturing a biopsychosocial perspective on health, while also trying to incorporate more of a public health perspective into people's, our undergraduate students' mindset. So was there for 10 years, and then just wanted to change. It was a change for multiple reasons. It was a change for career reasons. I wanted to get more involved in research and more involved in real world healthcare research. I wanted a change in geographic location. I wanted a change in financial situations. I just wanted to change generally. And so had been starting to think about what that would really look like. And so started to explore different opportunities to a greater extent, try to communicate with people who are in those fields to a greater extent. And then that led to my current position. So one of the areas of the geographical areas that I was very familiar with was where I am now, which is in Corvallis, Oregon. I have some family out here, and it's sort of been eyeing, hey, if I do make a move, which is going to be a big move for me, I'd like to move where family might be closer. And so I've really been keen in on opportunities in this particular area. Happened to see an opportunity at Samaritan Health Services almost as soon as it got posted, and then jumped on that. And luckily was able to land the position. So I started here in January of this year. I finished up the fall at Knox, and then made the jump here, and I've been here for about a year. Brandon, on to you.
Thank you so much, Andy. All right. For my journey, my mission, vision, value, and goals, really, to me personally, equity is very, very, very close to my heart. I really believe in equity and access. In particular, I recognize first of all, I'm a first generation college student to immigrant parents. They came over here during the war and escaped it, on about all the crazy stuff that a lot of people may resonate with and understand in some way, shape, or form, and can even understand even if it doesn't apply to you. But I've often found that I've been extremely privileged to have the opportunity to go into academia, especially higher education academia. And so growing up, it was really challenging for me to understand, like, I didn't have guidance. My parents said, just go to school, but what does that mean? And when you peel back all the different layers of the onion, and all you're left with is a dissertation in tears and all these other publications that you got to do. But I often found that I didn't have access to a guide to tell me some of these things. And so I realized that has to do with access to education, access to knowledge, access to the networking and opportunities like the ones that SPHN is offering us today to learn more about these things. So thank you for that as well. And so equity is very close to my heart. And in general, I strive to elevate and lift up everyone that I can within the realm of my work that I can do. In terms of my educational journey, I am a proud UC Riverside super alumni. I was there for a decade. I did have a lot of concerns, and with that conversation about diversifying my research experience, staying at the same institution for undergraduate and graduate school, that was a very real consideration for me. However, I was constrained due to a variety of family constraints. For example, my dad had health issues, and so there's a lot of reasons for me to stay local. And because of that, though, I ultimately stayed at UC Riverside for as long as I did. But I also wanted to note my advisor was super supportive of me, as I often juggled with this idea of, am I going to do academia, or am I going to do something more localized or industry? Because I knew from the early on that I would be landlocked, which is a barrier for a lot of people who are considering academia, to be able to move across the country at the drop of a hat if that's where the job happens to be. I didn't have that flexibility. And I just want to give kudos to my advisor for being so supportive. And it meant a lot to me as an individual, because everyone around me kind of feels like they're all on track to go academia. And it feels like I'm the weird one here because everyone else is on track to go that way and I'm looking the other way. At times it's a little isolating, but to have someone say, do whatever's best for you. At the end of the day, it doesn't matter what you do, as long as you're happy and satisfied and like you have what you want in your life, then it's good. So I feel like my advisor was supportive of me, and that really empowered me to kind of dive in deeper into what I like to do. In terms of my background, I specifically focus on healthcare communication. So I was really interested in understanding health belief models. Why do people do what they do? How do different health beliefs differ across different populations, such as first-generation migrants versus people who are more educated, people who have lived experience, and really understand that cultural layer to disparities in health, and also understanding disparities in understanding of health concepts. And so with that, through this work, I was actually able to secure a partnership through my advisor, who was working with the local hospital. I was able to jump on this project in which we worked with the local hospital system to look at research and client data from the hospital system. And so I feel very fortunate and lucky in the sense that things kind of just worked out for me, but I'm not saying that that's something that everyone else is going to have. But I hope that my journey and experience kind of gives ideas about where you might want to start if this is something that you may want to do. And so because of that need to stay local, because we had this partnership with a project with the local hospital system, I got further involved in that hospital. I got more involved in local government. And then I saw opportunities to apply my skills and knowledge more locally. Yes, I love the idea of a publication, and I love the idea of sharing information. But I think for me personally, I realized, and I asked myself a lot, where can I make the most impact in terms of the day-to-day people? Where can I make the most impact on my local community? And I found that, I feel I can make more of an impact via working with the local government. Not to say I don't appreciate publications. I still have published and continue to publish now, just not as extensively as before. But it was really meaningful to me to have the opportunity. And so when I actually started as a professional intern. I was a student at the time, doing a student internship with the local county. And so I started as a professional intern. When I started, I was actually working on employee recruitment and retention work. So why are people leaving? What is going on? This is around during the pandemic when things were starting to filter back in again in 2021 or so. From there, once I graduated with my PhD, I became a research specialist with the behavioral health department at the hospital. From there, I got promoted to a supervisor, and then I recently shifted over to a business process analyst as my team restructured and joined a different office. And so now I started out doing a lot of work with running reports, giving data analytics and things like that to more of a strategy and business process role now, where I really communicate with other people to understand what is it that your agency is doing, what are your gaps and challenges, and how can we fix them. And so in my current role as a business process analyst, we're kind of a really small, nimble team that is in charge of leading the transformation of the system to be more lean or Lean Six Sigma. This is this idea of continuous quality improvement. The idea is that if we cut out waste in our system, it creates capacity to be more efficient. And so I really focus on championing the roles and principles of respect for people and always engaging in continuous quality improvement. And then Andy, feel free to talk about your current role and work.
Yeah. Yeah, just jumping back. So one of my motivations for the switch into the position I am now, which I did mention before, is sort of a motivation that is really field oriented. I think we need people like me and people like you in my type of position. And I say that because time and time again, I would hear conversations, for instance, at the Health Pre-Conference of, do we have the people with our background and our knowledge base and our approach to science in the on the ground settings like healthcare, who can really translate the valuable work that we do to these particular settings? And oftentimes the answer being no, we don't have enough of those people, at least as far as I sort of interpreted what those conversations were. And so I keyed into that, and I thought that would be really interesting to be in that particular setting and be at that the point person for translating what we do into more of a healthcare setting. So jumping back into current work, so I'm fleshing out some things from what I was saying before in terms of where I am. I am at Samaritan Health Services. Samaritan Health Services is about 6,000 employees. There's 5 hospitals, 5 emergency departments, 7 urgent care clinics, about 100 specialty clinics. In the Tri-County area that I live in, which is Benton, and Lincoln counties in Oregon. We cover about 200,000 patients. Part of what's interesting there is, one, I'm in a large organization, at least for me, a much larger organization than what I was in before. So at Knox, we had maybe 120 faculty, maybe 500 employees over the entire college. Here, I'm now in a much larger organization with much more sort of complexity to how it is you learn about what your employee community is and who you work with and how you go about getting projects done. The other thing to point out here is we have 200,000 patients. That means we have a lot of data that we can potentially work with. My position specifically is in what we call our research development office. We are 3 people. My manager, Galina, who's a PhD in social epidemiology and has worked for Samaritan in the research department for, I think, 8 years now. My colleague, Zoe, who's a master's of public health and epidemiology, and also brings some biostatistics expertise. And then me with the social psychology background. We are here to support all things research within this big system that we have. Including investigator-initiated projects from within the system, as well as external collaborations. And for us, those external collaborations primarily start out with Oregon State. So Oregon State's in Corvallis, we're in Corvallis. It's an interesting setup where we are a community-based healthcare system that is not an academic medical center. And Oregon State, although they have lots of health research happening, is not directly affiliated with a healthcare system. And so we're trying to really forge collaborations there, but are super interested in collaborations beyond that as well. For external collaborators, we can facilitate access to data. That's our electronic health record data. We can also facilitate clinical services. We have a clinical research office that can help do things like blood draws. And then we can help with recruitment. We can send messages potentially out to all those 200,000 patients in the system to recruit them to be part of studies. My specific roles, I have 3 buckets. One bucket is helping support manuscript and grant writing from all projects that are happening within the system. Second bucket is really trying to facilitate those external collaborations. So I'm often over at OSU and talking with faculty members there and trying to reach out beyond that too, to even, starting with our SPHN community. And then third, new research, which is where I can support what has been my program of research, but also develop new research projects. One of the reasons I outside of sort of field level reasons and personal level reasons for getting into the new position, again, was expanding the research that I could get involved with. So when I was at Knox, I had an amazing experience at Knox. I loved my colleagues. I loved the setting. I loved the action, teaching, all of that. But it was very intensive in terms of teaching. And so I was able to keep a research program afloat. But my strategy for that was to sort of have a narrow program of research where I felt like I could really get into the details of it and develop real expertise in that. While even though I might sacrifice getting involved in other types of projects. But at some point I wanted to get into other types of projects. And here I've had that opportunity in spades. So just some examples, I'm working with some sociologists at OSU, our team here at Samaritan, and then some people in the housing services space in the Tri-County area that I live in on projects where we've merged housing services data and then healthcare data from our system to get insight into the relationship between housing services and healthcare use and healthcare outcomes. The stigma project that I was discussing earlier is associated with what's going to be a new addiction consultation service within our system. So we have patients who come to our system who are while they are here diagnosed with a substance use disorder. At that point, they need treatment for that substance use disorder, but not all of our providers in our system are well equipped or or have lots of background in doing so. And so for that, there's a gap in care. And one of the solutions to that has been a consultation service where we'll have a board certified addiction medicine specialist who will be able to provide consultation for how to treat people with substance use disorders. So part of that project is just evaluating, is that doing what we want it to do, and is it improving treatment outcomes, which is a quality issue, but like healthcare quality issue, but then also attaching to that a project on stigma. One of the primary goals of a consultation service is to also reduce stigma, not only of the care side, but also on the patient side. And so we're asking that question, is that actually happening? I've gotten involved in helping with a grant for a new screening instrument for rheumatoid arthritis. That's in consultation with one of our rheumatoid arthritis providers in the system. And then recently, and this is a really cool project, we did a randomized control trial about the effects of an ambient AI listening device for note-taking for providers in visits and its impact on efficiency and burnout. Missing T in that burnout, I guess. Burnout in the healthcare industry right now, burnout's a big deal. Providers are burnt out. And so there are constantly attempts at finding solutions to reduce that burnout. And one of those solutions is ambient AI scribing, where providers can go into a visit with a patient, use this ambient AI listening device. That ambient AI listening device listens, and then uploads notes into the electronic health record system without the providers having to do anything except go back and check those notes. You can imagine that would improve efficiency and also decrease burnout, because a heavy burden on providers is having to take notes about visits. So we did a randomized control trial on that involved our research development office, that involved input from information services, that involved information from our informatics people, that also involved input from our higher C-suite people. Really cool project. But all of these sort of really myriad projects involving multiple collaborators across multiple disciplines, all on the ground, what we're actually trying to accomplish in healthcare, but also really interesting projects. So pros and cons, and we want to have a lot of time at the end here for you to ask questions, so I'm going to try to skip through this really quick, but mention this, multidisciplinary team collaborations. I think that's a real plus of my position now, and positions like, other positions like mine. I'm in a real world setting. The healthcare industry is a real world setting. We're dealing with real patients. We want to have insight into care for those patients. I've got more work-life balance. I do not have the hectic pace of a semester or a term where there's just go in terms of teaching, in terms of sort of the academic mindset always of do more, that doesn't exist in my current position. That might exist in other positions like mine, but in my current position, it does not. I'm set for 40 hours of work a week. I do that 40 hours of work a week, and then I put it to the side and I go home. I've got more of a research focus. This is really beneficial. And then my salary is better. And this is an issue, I think, within academia. There's concern about overwork and underpay. That was definitely true at my college where I was employed before I came here. It's just sort of the nature of, I think, the education industry right now. But I was able to procure a better salary, and that's kind of a plus to me. It's not the end all be all. I'm not after my career for money by any means, but it's nice to have a little bit more money. Some cons: it is a corporate environment, and it's the not academic environment, and it's a different vibe. I really like the academic environment, so there's something really something that really resonates with me to be on on a college campus, on a university, around other academics who are super interested in ideas, and have sort of freedom to really explore those ideas. That's not so much the case now. And that sort of ties to that next bullet point. It's not an academic setting. It is interesting working in the space where the orientation isn't necessarily towards what I was just talking about in terms of ideas. Evaluating ideas, really thinking about those ideas, really discussing those ideas, and then trying to answer questions about those ideas. It's less, people don't have as much time. It's more action orientation. It's more of coming to some sort of solution for a particular problem. And so if you're thinking about this type of position, you're thinking, well, I have opportunity to sit with my colleagues and really discuss interesting ideas, probably not as much. But you get out of that also that good feeling of doing action-oriented, solutions-based work. Okay, that's me. On to you, Brandon.
Thank you, Andy. And so describing my work a little bit, I currently work for the County of Riverside, and I've been with them since I graduated with my degree. And so just a little bit of context, the County of Riverside has over 21,000 employees with over 2.4 million residents, and spans this whole chunk of the state. It's the second largest county in California. And in my office, Office of Service Integration, now being relabeled System Integration, is I'm part of that small, nimble, lean transformation team. And so when you look at my day-to-day work, generally it breaks down like 50% of my efforts go into interagency relationships. And so interacting with multiple divisions and departments within the organization to understand what is your process, what are the gaps, and how do we integrate processes between them. The biggest thing about my team is right now, just to give a little bit of context about what I do, is that at the moment, if you come into the county system and you need multiple services, like maybe you need mental health, physical health, and a food pantry, you got to call three phone numbers and wait for 3 calls back and hope that all 3 of them will get to you. What my team is trying to do is that we've implemented a model where we have one-stop shop. You can go to any door and get hooked up to any services, because the issue is, again, access and equity. We recognize that people don't often have time if they work 2 jobs to go during business hours and get the services they need. They often don't get them in time. And so these social determinants of health exacerbate the issues. They have more health issues long-term, more acute illness, more chronic disease, and that ultimately costs more overall. And so a lot of my job is working with teams across the board to make sure, are we talking to each other? We need to get rid of these siloed approaches and communicate with one another. How do we put the person first instead of the services first? And so that's a lot of my effort in terms of like 50% of my work. The other quarter of it is strategy and policy deployment. And so it's understanding these are the new government and legalese coming from the state, federal levels. How does that inform how we have to modify our workflows to be in compliance with these new regulations and guidelines? This also includes a lot of grant writing for funding streams. And what's interesting is that with grant writing, it's not a single project. You often collaborate with multiple teams across multiple divisions, and there may even be like 15 people on a grant that each do a little part of it that rolls up to someone else in charge. Additionally, the other quarter of my time goes into system design and technical support. Because we're new to this integrated system approach, there's a lot of learning that we're getting through. Again, how to go from, I only manage my own services to opening up the doors to any service that the county offers. It's a lot. And so there's a lot of time that I spend providing technical support for that and figuring out how to design the system to make sure that everyone can communicate with each other. Just some example projects I worked on before and have been continuing to work on is addressing social determinants of health and service access inequality. So in particular, understanding in California and Riverside County, we're actually predominantly Hispanic. And so taking a lot of what I learned in graduate studies, all the DEI equity seminars and all this stuff has been really helpful for foundational subject matter expertise and understanding these concepts. And so it's been really helpful to understand that. Additionally, kind of with Andy mentioning his work on the unhoused population, this is a significant issue across the country right now with unhoused individuals. And so I'm working on a project supporting unhoused seniors with disabilities because they're some of the most vulnerable residents. Not only are they unhoused, but they also have some type of physical or mental disability that renders them challenging to do day-to-day things. Additionally, a cool project that I was lead on was improving mental health among adolescent youth. This is a collaboration with the local school district. So this is really cool. After the pandemic, we found that all these kids and teenagers coming back to in-person learning were struggling with mental health. And so we created an integrated service workflow that brought the counselors to the kids in the schools. And so that was really cool. Finally, I'm also managing partnerships with community-based and nonprofit organizations, recognizing that we as government have a lot of stigma associated with us. There's a lot of reasons why you might not trust government for a variety of reasons, recognizing that cultural differences and things like that. And so we often rely and work with community-based and nonprofit organizations as trusted members and messengers in the community to help create that rapport and build that trust. In terms of pros, just like Andy mentioned, multidisciplinary teams, and really a lot of the work we do is cross-cutting end to end, because oftentimes when you're in research, you only sit on like one part of it. You maybe only focus on like all the background literature and you kind of send it off and hope for the best and hope it does things. I found that I get to follow the work through the whole entire process and see it through. So that's been kind of interesting. With that, there's also pros of real world settings, but also with that consequences. I didn't give enough credit in grad school to non-parametric data. And so that's what my thing would be. Like, if I could go back in time, I'd spend more time understanding non-normal data, because you're not in the lab. Nothing is perfect. Everything is skewed in ways that you never thought were possible until you see it. Additionally, there's also diverse work experiences. In my role now compared to before, I used to be in a cubicle most of the time. So I'm constantly intermingling and meeting with people across different places. Decent salary with benefits. Another pro is defined work hours. In terms of cons, this is a corporate environment, as Andy mentioned, and all that goes with it, non-academic, but also a con for me personally is managing work-life balance as a former academic. I am grateful that I'm hourly, so after 40 hours, like I technically don't get paid anymore, but I constantly find myself doing more when I shouldn't. And I have to remind myself, because I'm so used to grad school, like there's always more things to do, that idea sparks in like 2 a.m. I got to write it down somewhere, but I'm like, I'm not getting paid for this. And so just thinking through some of that. And so we really want to take this time to kind of shift the conversation over and focus more on what are the things that people would be useful for you. And so, Andy, if you don't mind, I'm going to just run through this a little quicker just to give time for Q&A.
Yeah, or how about, I was thinking maybe we should just open up for Q&A now. Maybe we hit some of these questions, but we can come back to these
absolutely.
if people don't have questions. Is that okay with you?
Yeah, I'm cool with it. Would people benefit from Q&A at this time instead? And we'll pass out the slides afterwards and stuff too.
Yeah. If you have questions, you put them in chat or feel free to unmute yourself and go ahead and ask.
Thank you, Brandon, Andy, and Renee. This has been so insightful and useful for organizing and talking about your experiences. I have a lot of questions, but I'll start off with where did you find these jobs? Because I heard that there's a lot of like connections. You have to make connections in order to acquire these positions. And I'm wondering if that's your experience as well. And if so, how to get those connections.
Yeah. Can I start, Brandon, and you go?
Yeah, absolutely. Yeah, of course.
I would, heavily lean on connections. And I emphasize that because that is something that I feel like has always been a weakness for me. I'm not super prone to social, like to network and develop connections in the way that I think is really conducive to finding jobs. But lo and behold, this job that I found was through a connection. A connection pointed out a talk that my manager was giving, like a webinar. I watched that webinar. We struck up some conversation. We then had sort of ongoing conversation throughout the year or two after that webinar, where I'd message her every once in a while just about interesting ideas. And so it was, and then ultimately when the position opened up, which I was paying, I have ongoing, or I had ongoing LinkedIn searches. The title that I typically searched on was research scientist, and research scientist in health. So through that ongoing search, this position opened up, and because I had that relationship with my manager before, I was able to communicate with her about the position and then move forward from there. So it was a classic example of knowing people and being connected to people is super helpful. And every other point of advice I got outside of that was, if you are interested in a position, and you see those types of positions out there, try to reach out to somebody in those positions and just say, hey, can I take 10, 15 minutes of your time just to ask you about what your position is and get to know you a little bit. And hopefully, you know, not everybody's going to be up for it. Not everybody's going to help you propel forward from that. But I think enough of those opportunities, having enough of those opportunities will afford those additional opportunities.
Yeah, I think echoing that too, just on Andy's point, is that you don't know what you don't know. And Chandler is unique because we're both in the same institution, so we have some common networks. But what I learned is that I really didn't know what I didn't know. And I realized that a lot of faculty members, even within my own department in psychology at the time, or social psych or developmental, they had so many connections to government entities, nonprofits, that I just had no information on because I never took the time to ask. And so what's crazy is that I did this whole partnership with this nonprofit, and it's fun. I met the director and I said, hey, 2 years ago, I worked with you and gave a seminar to high school kids about how to apply for college. And she was like, no way. And it's because I knew a faculty member who knew someone else. And so it's really about asking around, because you simply don't know what you don't know. I also want to go back in the chat because there was a comment from Cinnamon just to go over some of the previous questions. So I wanted to give courtesy to that. So will my skills apply? Absolutely. And I'm going to go pretty quick to this because there's a lot of questions here, but the idea is really understanding less about what it is that you're specializing in topic wise and what are the general skills you have. So statistics is definitely a plus. Knowing R is a huge one. Knowing SPSS is another huge one. All these technological skills that you have are immensely powerful. How do you find jobs? What are typical job titles? I'm going to go ahead and drop some of them in the chat. But things like analyst, researcher, research scientist, data scientist, statistician, biostatistician, these are all different examples of keywords that you can use to kind of find some of these roles and jobs. What materials do I need? Often this is actually changing. The hardest thing that I found, and Andy, feel free to jump in if you agree, turning a CV into a resume. That was so hard. Because it challenges you to rethink everything you did. And actually, I felt like a lot of it was taking away things that I felt like were my identity in graduate school. It was less about what you do and who you know like that. And it's just like, what skills do you have on the table that can be useful to this organization? What is a day-to-day structure and job, not an academic setting? I think this kind of lends well with another question that was brought up that said, can you talk a little bit more about the corporate environment and what that means to you? So Andy, do you want to go ahead and start off with that? And thank you, Nathan, for that question.
Yeah, I think so. Maybe picking up with that question about corporate environment, it's an environment where I think there's always a focus on the bottom line. These environments, and I'm in a nonprofit, just to be clear, but there's still a need to have money to keep the organization afloat. And so there's more of that focus with more of a top-down from leadership to employee focus. And I think within that, more of a constant sort of structure on what is the work that you are doing mean for the organization. And so a lot of the research questions that I get involved with are at some point ultimately research questions that are really still about what the organization is doing, how it speaks to the organization, and generally too how that ultimately impacts bottom line. Another sort of superficial, I was telling Renee and Brandon about this beforehand. I work in a cubicle, and that's not necessarily the most fun thing. And yet here I'm sitting in an office, which is a hotel office. There's just different language, there's just different culture around it. I'm in a hotel office where I can plant it up for a little bit and use the monitors here, and then I go back to the cubicle.
Yeah, I think going on to that point about like the corporate environment versus academic is that something that I found is, as Andy mentioned, is everything has to have a very distinct purpose. Depending on how you look at it, it often aligns with return on investment because it is industry. And so in academia, you can just kind of look at your data and be like, huh, why did that happen? And like spend an hour or two just deep diving into learning and be like, wow, that's so cool and like really novel and give you a brand new research idea to look further into. with the corporate environment, there's less freedom to do that. It's more so everything, all your research questions have to be targeted to a specific aim. And so even when I talk about my work, and I love what I do, but realistically, the idea of integrating services to one-stop shop, I'm focusing more on the customer experience, but in reality, depending on who you ask, they're thinking about it through the lens of return on investment, wasted costs, spending time for a doctor where the client doesn't show up, things like that. And so it's being able to understand what is your role relative to this broader system. And I admit, like, to a certain extent, like, I know that it's revenue oriented. And so I kind of keep my head in the realm of this side where I'm thinking, how am I helping people on the day-to-day level? But I think those are some of the things that kind of speak to that corporate environment versus the academic freedom you would have almost in a college campus or an educational setting, if that makes sense. Yep, absolutely. So I'm going to go ahead and just pitch the next question, like specific courses or training to consider while in graduate school. Andy, you got any thoughts?
Yeah, we came up with a list. I think some things to consider: a biostatistics course. Maybe that's part of your statistics training anyway, but sorry, I'm having trouble with that word today. A biostatistics course would be advantageous, just so you're more familiar with the language and approach to data in this particular setting. A health disparities course. This connects to that emphasis on social determinants of health. Maybe even a medical terminology course. There's so often when I'm trying to navigate our data and our electronic health record, and oftentimes I have no idea what I'm dealing with when I'm looking at specific terminology. I don't have much of a bio background. I don't have much of a medical background. A health economics course would be really interesting to take. This connects to thinking about bottom line, return on investment. There's always some sort of economic perspective and economic angle that's happening within these systems. Health informatics, electronic health records courses, also really good to seek out and learn from.
Absolutely. Thank you, Andy. I think just piggybacking on that too, I think for me, understanding biostatistics is a big one. I would really want to echo that because in the realm of health, there's often different terminologies that is unfamiliar, and half the time you think you're talking different languages. You're like, oh, your A is my C. Okay, that makes sense now. With that too, I think something else to think about is in terms of courses is expand if possible. Try to consider taking other classes that branch into other realms. So for example, a lot of insights and connections I found were actually taking some of the med school classes, things that were a little more on the psychiatry side of the house or clinical versus things more social oriented. Additionally, something that you might be able to do right away is ask around. You can just ask some of the faculty members you're cool if they have any projects or collaborations with any hospital or health organizations nearby. I can almost guarantee if your school has a med center, they are tied to some type of government because there's billing that needs to be done. Another thing to consider is that in my experience, we have mountains and mountains and mountains of data. We don't have the manpower to analyze them. The challenge that we have is oftentimes just managing the legalese, like how do we share patient data with you without violating HIPAA? But assuming all of that is squared away, we have connections with multiple college campuses. And so you might want to check, does your institution already have an existing pathway to connect and get data from your hospital system? Because that would be the lowest hanging fruit if you wanted to start a project or considering a dissertation or something like that. Are there any other questions from the group as we approach our last few minutes? Sorry, I see Chandler had a question in the chat. I'm sorry.
Yeah. Can I jump in really quick, Brandon, just so we don't miss this?
Yeah, please.
One of the things that Brandon and I really wanted to accomplish from this webinar was development of a group of people who continue to be interested in these types of positions. And so feel free, hopefully you have our contact information somewhere. Feel free to reach out to Brandon or I and just contact us. We both, I think, separately can be constant resources for you. But hopefully we can also develop a group of people that we can meet with on a regular basis to talk about different opportunities.
Thank you. I'd really appreciate that.
Yeah.
Yeah, absolutely. And go ahead, sorry.
Do you want me to answer Chandler's question about methods?
Sure.
I would say it's all, we use all the methods still. So that ambient AI listening project, that was an experimental project, a randomized control trial. The work I'm doing with Stigma, that's going to be survey work. So it's all of the above. In terms of amount of experience, yes, I think you can leverage your PhD. Then particularly if you get into a postdoc, you can leverage that a little bit more. I always think that when you see information about how much experience is needed for the position, they're putting that number out there. That's not an exact number. And I think if you kind of get interacted with a particular position, at some point they're going to learn the whole of you, and you may not meet like the 5 years of experience that you need, but they may start to understand that you're a really good candidate for the position anyway. So I would take those numbers a little bit with a grain of salt, and then just try to assert your background as much as you possibly can.
I completely second that point from Andy. And one thing that I encountered, and this is more a deal with HR, was when you say I was in a PhD, they said, no, that counts as half-time research because you're half part-time learning, half-time doing research. That was hard for me to hear, and I pushed back really, really hard. And so I want to second that. Take the numbers with a grain of salt, and it's more about, chatting up your hiring manager and let HR deal with the whole like that stuff. But if they want you because of the skills you bring to the table, then they'll make their decision. They can bend the rules a little bit based on what happens.
Thank you so much.
Any other questions?
I have a question. If you are pretty sure that you would like to pursue a position in industry, is it still beneficial to apply for and seek out postdocs? Or if so, what type of postdoc position would be beneficial? Or is it better to just get your feet wet and just go straight for a job in industry?
I'll let Andy go because he has a postdoc.
Yeah. Yeah, great question. I think honestly, I think either could be beneficial. I don't think one is necessarily better than the other. I think it depends on where you're at the time and what opportunities are presented to you. That said, I mean, it's not a bad idea to jump in as early as you can too, because you're going to start out probably with a better salary. You're probably going to start out getting to know learning quite a bit in your time in industry. I would say this past year for me has been a year of a lot of learning. And so to a certain degree, I kind of feel like I'm in a postdoc again, because I'm reorienting myself to a different type of position, a different type of work, different subject areas. And so like thinking through that as I say that, well, maybe it's good to jump in as much as possibly can, but at the same time, run with the opportunities that are available to you.
Yeah, I think for me, I did the opposite. I didn't do a postdoc, but it's interesting because I mentioned I was kind of teeter-tottering in grad school between academia and industry. If I could go back in time, I would have just picked one and decided, but like I always was leaning towards industry. I just get my foot in the door in academia because I thought I was supposed to, but I actually spread myself thin, in my opinion. And so going with what Andy said, like I didn't do a postdoc because I wasn't planning on going to academia. And so I jumped right in, but going with that point, if you're pretty sure you're set on it, like there's no real benefit per se of using those like 2-3 years to do a postdoc compared to jumping straight into the industry, because the pay might be more and things like that. But it really depends on what is it that you want to do, what is it that you're looking for. Are you looking for that expansion, new ideas, or are you looking to apply what you have and know? And so it's really a personal decision, but I don't think you can really go wrong either way. And so I'm going to pass it back to Renee to wrap up as we're at time.
Great. Thanks to you both. That was really interesting. Lots of good information. Just to underscore, if you have questions, things that weren't addressed, Andy and Brandon have both provided their contact information here. We will post this to our YouTube channel once I figure out how to do that. So again, thank everybody for attending today. It was really great to see such a wonderful turnout, and double extra thanks to Brandon and Andy for taking your time to share all of this great information with us today.
Yeah. Thanks, Renee, for supporting us, and thanks everybody for being here. And please feel free to reach out to us.
Thank you all. Take care.